Let's talk further about diagnostic blind spots. This is your OncoCare advisor and Dr. Raghav here. Welcome back. I want to share diagnostic blind spot helping you understand a problem and some solutions. The problem is, I heard from many people whom I spoke over the last many years during my medical practice that their diagnosis or their family member's diagnosis was delayed or missed for a while. So basically meaning missing red flags or the symptoms that they felt took too long to be worked up or too long to be recognized that something big is brewing in the body. But before we dive into there, let me share some simple examples. If someone comes to me who had smoking history of, let's say, about 20, 30 years, comes to me with a weight loss of more than 10% in the last few months, which is unintentional. That means they're not trying to lose weight. And having some unusual cough or shortness of breath that's a little bit more than usual. As a doctor, as a physician, my mind first goes to someone who smoked, having these symptoms, I should be getting a chest x-ray or a CT scan, preferably a CT scan. Because I have a differential in my mind that I need to work towards. So it's easier said than done. But that's where I should be going. Or if someone who is 50 years old coming in with explains to me that they've been having on and off bleeding in their bowels, never had a colonoscopy before, my mind as a physician should be going, does this patient need a colonoscopy? Do I need to test anything further to understand if I'm dealing with a colon cancer here? So that leads to, how do we find solutions for this? So before I give the solutions, let me give an example of how this works, right? Why those solutions are important. Let's say you go to a hairstylist or a hair person, a salonist, and first time you ever meeting this person, you get a haircut, you come out and you may feel, I don't know if I'm really happy with my haircut. But you go to the same person again and again and again for the next several months. As the months go by, you will actually start to feel like, I really love the way my hair goes in line with how my face is, my expressions are, my style, etc. So, what am I concluding there? The first solution in avoiding the diagnostic blind spots is having a primary care physician and having an annual visit every single year. Seeing your primary care doctor. What does that do? Just like the hairstylist does. They will know you better. They'll know what kind of a chronic health conditions that they need to look for. They will know what kind of test you need based on your risk factors to identify what is your risk of cancers. And how do we avoid them? How do we prevent them? How do we detect them early? They can have an opportunity to talk to you about screening for different tests, explain you the good and bad of screening. So the first solution is having a primary care physician. In my view, everyone should have an annual primary care visit to give themselves the best chance of beating the cancer in their lifetime. The second solution is being an advocate for yourself. That means if you are a patient or you're a family member of a person and they're having these symptoms, you go to see a doctor, don't worry about missing red flags. Be an advocate for yourself and ask questions. You can ask your doctor, do you think we need to do a CT scan? Do you think we need to do any further testing to identify why my family member is losing weight without their intention? Being an advocate for yourself is a key part of a solution. And The third solution is do not be afraid to ask questions. You should. This is your health. It means if you are going to see a physician, let's say a doctor did not examine you and you felt that I would like my doctor to examine me. Don't be afraid to ask. Doctor, can you examine me? Because I don't feel comfortable yet about these symptoms. Something is going on. Can you examine me? Or can you explain me what your next steps is in case if I don't feel better in a month or so? It might fall into your own advocacy, but it has a slightly separate feel to it. So let's cover this in a summary again. Diagnostic blind spots is a very important aspect of prevention of cancer and curing the cancer. But how do we tackle it? 3 points to make. The first point, everyone should have a primary care doctor whom you should see every single year. Second, be an advocate for yourself. Do not be afraid. You ask questions. You ask for tests. There's nothing wrong with that. Third, if you have any concerns, express those concerns to your doctor. If you need an exam, if you need a certain test, let the doctor explain to you why you need a certain test or why you don't need a certain test. So if you can follow these 3 solutions for the diagnostic blind spots, you have a really good chance of preventing cancer and beating cancer in your lifetime. I hope this was helpful. If you have any stories you want to share, if you have any questions, you want any topics that you would like me to cover, please DM us here. We'll be happy to do so. Again, this is your Oncocare advisor and Dr. Raghav here. Follow us for more insights into cancer care. Thank you.